Okay, welcome everybody to the February 11th Commission on Aging Well meeting. And I'd like to call the meeting to order. We do have a quorum. We have some voting issues, so we have a quorum to be able to handle that. First item is to approve the draft minutes. Did anybody have any additions or corrections? If not, do I hear a motion for approval?
So moved.
Moved.
All in favor?
Aye. Aye.
Oh,
So who said that? Ruth?
oh,
I'm trying to think who first and who seconded.
I don't know. I think Don and I were
Okay,
tied.
I
Got
think
it.
Don was second.
okay, perfect. All right.
Okay, there are no public appearance items, so we will move on to our agenda items, which part A would be the case management update from Amy and Sarah, our social workers. Amy and Sarah.
Thanks. Good morning, everybody.
Morning.
I can't see everybody's face. Hold on. But I don't. Okay, I guess I can't see everybody's face at once. But anyways, I'm Sarah Folkers. I am one of the, as we like to say, super social workers at the senior center.
Absolutely.
And my partner in crime / social work is Amy Jordan. Hello, Amy. So some of you already, maybe many of you already know what we do, but maybe some of you don't. So that's why we're here. So basically our job is just to keep older adults independent in their own homes for as long as possible. And we work with just people who live in Fitchburg, just people who are living independently, which means they're not living in assisted living or a nursing home. So they could be living in their own home, in an apartment, with family, with friends, any like a condo, an apartment complex, anything like that. And independently is kind of a broad term because a lot of people we work with aren't exactly 100% independent. They do need help with things like scheduling the medical appointments, getting to, there. Is that better? Somebody at City Hall just told me to pull my laptop camera
A
down.
little bit more if you can, please. Good.
That better?
Thank you.
You look great.
My background is a closet. It's really fancy. So just people, the things that we help people with to stay in order for them to stay independent, scheduling doctor's appointments, getting to doctor's appointments. People might need help with home chores like cleaning and laundry, maybe meal preparation. We work with a lot of outside agencies and city departments in helping people to keep independent. We get referrals from a lot of city departments, such as the police, the fire, EMS, building inspection sometimes, and even up at City Hall, the clerks might get a call from somebody who may seem a little confused or maybe is having trouble paying their utility bill, so they might refer them down to us. So technically we work with people 60 and over, but we like to help a lot of people who are younger. So pretty much anybody 50 or older. I did have a client once, she's 52 now, but she was 48 when I started working with her. So it varies, but generally it's 50 and over. Most of our funding comes from the city of Fitchburg, which you probably already know, a little bit from Dane County. And am I missing anything, Amy?
I just think our umbrella agency, just for your information, Linda, since you're the newest one, is we fall under the Area Agency on Aging, and there are 15 focal points or senior centers in Dane County. So we all pretty much do the same thing, provide the same services. And unlike most other senior centers, we are funded mostly from the municipality, which is
And I'll comment on that funding, because we approved that contract, and just to kind of remind you, we had 46,000 for case management from Dane County, which is all the money that the county approves put into a formula. So 46,000 came to the city of Fitchburg, and we put that towards salaries. And then the billable portion, which means any clients that they work with that are on medical assistance, we are allowed to bill up to $14,400. So if we see this huge influx, we can go back to the county to see if they would amend our contract and allow us to bill higher, which we have done for a couple years, and then they kind of watch those trends, and then they allocate more money. So over the years, that has increased, particularly the last 5 or 6 years, quite a bit from the county, as we were always the lowest funded focal point in Dane County. But as our diversity grows and we get more seniors in Fitchburg, and Amy and Sarah reach out to more clients, that funding goes up along with those numbers.
Amy and Sarah, are you involved at all in helping your cases get the coronavirus vaccine?
Yep, we are. Currently, we are working with Edgewood students that are Edgewood nursing students right now, and one of their tasks is to contact all of our people on our home delivered meal list route and other clients that we give them to either get the vaccine scheduled, find out transportation. Yeah, we are doing that. I just took somebody yesterday to go get their vaccine.
Great.
So yeah, we are. It's been a little bit challenging just because, as you know, we have offered through our center, hospice has offered a whole bunch of vaccines, but then a whole bunch of our clients were signed up at the pharmacy in Fitchburg, and as you know, they did not receive any of their first dose vaccines for last week. So a lot of people got canceled, including myself, including Sarah, which was disappointing because we are still going out into people's homes and taking them in our car. And so yeah, it's a work in progress. But I mean, I'm happy to say that almost all the people that I called to get the first dose over at hospice already had their first dose. So that's good news.
And the reason that I wanted to have Amy and Sarah come today is because, the cases that they're seeing are so much more complicated than we used to see 20, 15 years ago. And I still think there's a lot of misconceptions about, the social workers on staff, they're just helping nice older people. And we have a lot of interesting situations here in Fitchburg. So I just wanted them to come before you guys and share just a few stories or different cases, obviously leaving out names of issues that they're dealing with that aren't so atypical anymore, that these are what we're seeing more and more versus when it was just, oh, let's help somebody get to the senior center so they can have lunch and play bingo. It's not like that. And so I think that my goal this year is to continue to make sure that the city and other agencies and other departments within the city are aware of the critical needs of our community and how we deal with those needs. So I've asked them each to share a couple cases that they are currently dealing with or have in recently. So
Yeah. I think this year's been super challenging with COVID, for sure. I think the mental health issues have skyrocketed. People are isolated and not getting out. And one of my cases that started in the fall, after being months at home alone, I had a client who had attempted suicide just from COVID, from feeling very isolated. She had multiple hospitalizations over the fall. I worked with many different organizations to keep her safe at home, to keep her busy, so that this isn't a repeat customer. It's been challenging. You're talking about people who have mental health issues, but then also don't have access to computer, to do Zoom, to connect with family or friends, not even leaving the apartment. So really, this person's only link is myself, a phone, and a home health worker who just comes in temporarily after she's been hospitalized. So that was a person I took to get the vaccine yesterday, and she was really relieved. So I'm hoping that with this case in particular, that this will open up more doors for her that she can leave her apartment. The other case that I had most recently was a woman who appears to have early onset dementia, and she took off and she ended up in another state and working with the police in order to bring her back and to get her services, along with a husband who is in denial that there's any type of memory impairment, even though she's all over the place. I mean, literally all over the place. So she ended up in Iowa. She also ended up in Illinois. She was headed towards Kansas on a snowy night in December. So those are just two.
Driving?
Pardon me?
Was she driving?
Yes, she drove. And an out-of-state trooper found her and brought her back to Wisconsin. She had made it as far as Iowa. Yeah, it was scary. Then I don't want to play always on the mental health aspect, but we've got a lot of people with mental health issues in Fitchburg, and that takes up, I think, 90% of our time. I mean,
And some of us are on this call.
yeah. Alex. No.
I'm just going nuts. Just want you to know that.
She'll leave your name out, Alice, when she talks
Okay.
about the case.
Oh, and how could I forget? We have a client that is having a hoarding issue in her yard and just really causing a disruption to neighbors, and it's becoming a really big issue. So that's just a few. I could go on and on. Really.
Well, along with Amy's trend of mental health, I also have a case that I've been working with the police on. Where, to back up a little bit, the police have a group of officers who are trained, specially trained in mental health response, and it's their crisis intervention team. And in the past, we haven't had as many referrals to that program, but we're wanting to refer people a lot more now because of the pandemic and the increase in mental health. And so we're working on with one of the lieutenants, or Jill is, and then Amy and I will be too, just to kind of revamp and rework that program so it works better for us, meets our clients' needs, but also, identifies those police officers who are really interested and really want to work with people with mental health in the community. And so one of those is a client of mine. She lives in her own home, has a long history of being paranoid and accusing a person in her condo building of burglarizing her condo over a period, multiple times over a period of several years. And this is, it's never happened. That's not reality at all, but she has a history of calling the police and reporting that this person is burglarizing her apartment. And then all of a sudden she finds the things that she thought this person stole in her apartment, in her condo. Amy's, we've had a lot of cases like this over the years, but this one in particular has sort of ramped up over the pandemic. And so I'm just getting her connected with a police officer that she can have, the direct contact with to call when she's feeling like this is happening. She's also somebody who, she does still drive, but she doesn't drive a whole lot because she's kind of nervous about driving, and she's 10 years overdue on a colonoscopy, and she's been losing weight, and with no unexplained reasons excuse me, for losing weight. And so I've been going to the doctor with her, making sure she gets scheduling the colonoscopy for her, making sure that she gets the labs done that she needs, and gets a chest x-ray because she has a history of smoking, and the doctor's concerned about possibly colon cancer or lung cancer. So that's somebody that requires a lot more time than other people. She does have a friend that helps her with things. So it's not just me involved, which is nice, but she doesn't have any family in the area. So that's really one of the biggest challenges is people who don't have any family. That we're really kind of the only person that's there to make sure that things are followed through on.
Do family that's not in the area get involved at all?
Yeah.
Mm-hmm.
It's hard, but they do.
In what way, Amy and Sarah? Like, how would it give an example of how a family from out of the area might try to be more involved?
Well, this woman in particular has family out of the area, but they're not involved. And some people have family in the area and they're not involved because it's a toxic relationship or the client has burned a lot of bridges with their family. And so the family really doesn't want to be involved with them at all. But family family out of state,
We participate over the phone. They connect with their physicians. They connect with us. I mean, I think that it can happen as long as there's good communication. So I've seen it work both ways.
Yeah.
Yeah.
And I think it gives family out of town, those that are connected with their older adults, it gives them a really nice comfort level knowing that, Amy and Sarah are those eyes, on that client that they don't have. And so when they can see changes, they can report that back to the family. And that's really helpful. Having parents out of town, and like Don, when you have somebody that can see somebody, within a day or two, it really helps reduce a stress level when you're in distant. What's that?
Or increase it.
Or yeah. So
You've mentioned that the problems have increased over many years. It's been exacerbated by COVID. But what are some of the other causes of this increase in the need?
Poverty, people are living longer. There's more needs as you get older. There's no affordable housing. I'd say money and the longevity is just increasing. And, the older you get, the more issues there are, the longer people are living. So, I mean, I have a client that's 103 that is still in her apartment. Should she be? Probably not, but she doesn't want to go anywhere else. So
I think a big factor too is that, years ago, families did live close by, and a lot of these older adults have lost that support system. And that really impacts the work and the support that, I think we need to provide for those older adults, because it's all about prevention, and prevention is about cost saving. I think too, there's a lot more acknowledgement of issues like dementia and Alzheimer's. 20 years ago, you didn't really talk about that. Somebody was just a little crazy and they were left alone in their hoarding issues. So I think that some of these issues are more common, so they're more identifiable, they're easier to talk about, and then they're easier to address.
Thank you.
Go ahead, Ruth.
What is your caseload a month? And how many clients do you get additional per month?
It varies. It really varies. Amy, how many people do we have on our case management 610? Like 200?
we've got like 200 people on our 610. And we're either connecting by phone or seeing some of those people. But the new people, Sarah and I divided by the alphabet. So we do get new cases every week, every month. I don't know, maybe 2, 3, 4 a month.
That's what I was going to say.
It's been more during COVID.
Right.
What does 610 mean?
It's a report that we use for the county for our reporting purposes. Yeah.
When you get new referrals, do they tend to be long-term, or just you're referred because of a particular issue, and once that's taken care of, they're fine?
Most of the time it's long, somebody needs long-term ongoing assistance, but one of the biggest requests that we've had over the pandemic is calls for durable medical equipment. People needing canes and walkers, shower chairs, that type of thing. There was a lull for a little while when no procedures were happening, but then, it kind of picked up again, and we get a lot of calls every week, multiple calls every week for people that need a walker because they're having a surgery, or need a cane because they're having a
Sure.
surgery.
And those are
So
short term, yeah.
Right, that's all short term. Maybe that person might turn into a long-term case management client, but most of the time it's the more independent people who are having the surgeries and they just need some medical equipment to borrow. And so that it's been nice to have all of that medical equipment to loan out to people, because that's been a high need.
I would say, what do you guys think about home delivered meals? To me, from what I can see, we get new meal clients almost every week now, but then I do see, oftentimes people go off because they get sick and go in the hospital. It's generally not because it's less often because, oh, they had a surgery and it's kind of intermittent. It just fits that need. But wouldn't you say we get a lot of home delivered meal client referrals?
I think over COVID, most
Yeah.
definitely, we've had a lot of people come out of the woodwork.
Yeah.
That. Well, and with the new apartment building in Fitchburg, the High Line, we've had an increase in services overall.
Right. Yeah. Mm-hmm. Aries. Any more questions for Amy or Sarah? Dorothy?
I was going to say one of the most difficult things that I used to encounter when I did a lot of home care, and I did a lot of nursing home care as a CNA back when. And one of the most difficult things for me was when people just want to be allowed to die because their quality of life has gone so far below zero that they just don't want to be here anymore. How are you guys able, do you guys encounter that, and how are you able to work with it?
Well, I think we would connect those people with hospice, hospice. But yeah, I think there are some people that are like that. I don't think I've had any recently, but I think hospice is a really good resource in our community for those people that are experiencing that.
Well, people still have choice, right? You
Right,
guys,
they have choice,
you
absolutely.
can't force them if they say, how many people have you seen that haven't seen a doctor for 30 years and
Yeah.
they're not going to, it's just not important to them, and that's their choice.
Yeah, well, I have a client he's in rehab right now at a nursing home, but he's 93 years old. He lives in his own home, which is a nice home, but it's way too big for him. He has a nephew who lives around here and who's very involved, and the nephew really wants his uncle, my client, to move to assisted living or a nursing home. And my client is still his own decision maker. He's his own person. He wants to die at home. And the nephew is asking me, well, what can you do about this? I can't do anything about it. I can talk to my client and encourage him to maybe move to an assisted living facility, because he would benefit from that. But I think sometimes family members or neighbors, if neighbors call about somebody who they're concerned about and they think, oh, they shouldn't be living at home, what can you do about it?
We can't.
We can't, because people are their own decision makers, and we can try to support them as best we can so that they're safe living at home, but that doesn't always work. And a lot of times it takes a crisis to actually get somebody alternative placement that might be necessary, but they don't necessarily want it. So it's hard. It's hard to help people with family involved sometimes, because they expect that we can do more than what we actually can.
Any more questions, guys?
Well, thank you for what you do.
Yes,
Can I jump in? This is Alice. I just wanted to give kudos to Amy and Sarah, because my friend over at the apartments at Chapel Valley were without heat for 2 days. And they were cold.
I know.
And I know that they really appreciated what you did. And I also wanted to say that the fire chief was a friend of mine, called the development and said, you know, what are you going to do about this? It's 60 degrees in their apartments and they're really cold and they're elderly. And well, they didn't think they could do anything because the boilers were just broken. And eventually the fire chief called and really helped get things going. And Gabrielle, I guess, was very good over there. And it's just wonderful to know that there are people out there that are willing to reach out and do to help others. So I think you get lots of kudos.
Yeah, thanks.
Thanks, Alice. We've both been here a long time, so it's obvious we love our jobs. I've been here 15 years and Amy, you're what, 17?
Something like that. I lost count. Feels like 40 in.
Do it by babies. Like we've all had all our babies on these jobs. My oldest is 24. So yeah. Well, thanks guys for coming on. Thanks for all you do.
Thanks for having us.
Amen.
Bye.
Bye.
Thanks. Bye-bye.
Thanks, ladies.
Okay, our next agenda item is resolution R4621. That's adopting the master service agreement with Language Line Services Incorporated. And Jill sent us a little information on it, but do you want to talk a little bit first, Jill, before we?
Yeah, sure. So I feel like I mentioned this translation service last time we met, and maybe I didn't, because I went back and so I have my notes that I talked to you guys about, and I had it on my notes, but then I referred back to my minutes and I didn't see it. So just background, this translation service, our student, so we have a social work intern, Eric Miller, and this was one of his projects. He's Spanish speaking. He's very interested in that population of older adults. He's been a great asset to the department so far. But anyway, he speaks Spanish, so we start talking about translation services via the phone. Which is something I just haven't put it as a top priority. Every time I think about, oh, we need to do more outreach, I get nervous because we don't speak Spanish and whatever. So he did the research. We found a company that you can just kind of pay as you go, that anyone of any language, if they call in, we can use this service via the phone to translate whatever language into English so we can understand. So he's been working on this since December. There were some issues with the agreement. It went to the attorney. I didn't put it on the agenda because because it was already delayed because there was addendums to the agreement that had to do with lawyer things that I don't really understand, but I just sent it to council. There's no fiscal impact because I will take the cost of this out of legacy funds. And based on how much we think we'll use it this first year, it literally will cost us maybe $300. You know, it's a per minute charge for the translation services. If we were going to do video services, maybe sign language interpretation, which we did have a client who was completely deaf, that the friends paid for some interpretation for American Sign Language. But anyway, I just didn't think this was a big deal. I was going to tell you guys about it today that we're entering into this agreement. So it went to council on Tuesday. I'm thinking no problem, but the council president said, oh, I want this referred out to the Commission on Aging. So here it is before you. Certainly it wasn't my intent to keep it from you or to not let you have a voice in this. I thought, to me, it was such a no-brainer that we would just get it through, you know, the layers of government as quickly as possible, and then we could start using it. So they wanted it on the agenda. So thanks to the clerks for helping me. Well, they did it, put it back on the agenda and get it out to you guys so we could take a vote and then send your decision back to council, and then they can vote on it one more time at the end of this month. So I'm asking you to, I can pull the contract up if you want to look at it. It's a lot of stuff, but
You sent
again,
it.
Yeah.
Yeah, I did send it, yeah.
A quick
Joe,
question.
Joe,
Um,
Go ahead, Don.
what is the cost per minute?
72 cents.
And is it such that there's a live person there, or is it done electronically?
I think there's a live person. You call a number and it's kind of on demand. They have people that are there that speak the language. Or if you want to make sure, you have to wait a few minutes, but you can also schedule them. Like if Amy or Sarah have a client, we can call them in advance and say, we are going to meet with this client at such and such time. They used it. The reason we picked this service is that Susie Jones, our office manager, this is what they used at the police station in dispatch. So she's very familiar with it. So you call into a number and then it's kind of like a third person on there that will translate the discussion. And so again, yeah, it's by minute. So I'm trying to think what else I was
Any
going to.
limits to what language, or all languages?
All languages. All languages. You can choose that language. I don't have I can't go into a lot of detail because I'm not sure about if it's kind of a unique language that's not as common as, say, Spanish, maybe we would call and schedule an appointment to make sure that somebody is available when we need them. And again, the American Sign Language interpretation, it was really interesting because we had to, well, again, the friends paid for it, but hire somebody to do that for Amy. This client did have a support person who also was deaf and did sign language, but so then we couldn't communicate with either. We could via email, but there needed to be a group meeting. And so we brought in this person and the friends paid for that interpretation. So anyway, again, I don't think we're going to spend a ton of money, but now that we have the option, now we can maybe start to advertise a little bit and say, we have this service you can call in, because we do have at least one or two clients that speak very little English. They're Hispanic, they're home delivered meal clients. So giving them the comfort level, knowing they can call in, say they're not going to be home for their meal, or they're in the hospital, or they need transportation. That was always kind of an issue. And we could work around that, maybe using Yesenia up at City Hall, or there's a Spanish speaking social worker at New Bridge in Madison that we could also use them for interpretation. So just one step forward to making sure we can serve all populations. And so again, my apologies. It wasn't an indication that your input doesn't matter. I just felt like I wanted to move it on through and get it going. And so yeah.
Why does the city not cover this cost?
It's really per department. The nice thing is now that we have a master agreement through the city of Fitchburg, so it's not my agreement, it's the city of Fitchburg. Every department can now set up an account. So basically I did the legwork, got the agreement approved by the lawyer. So now any city department can sign up. I can't answer that, Barb. I think it's just, they don't have it in the budget. I talked to the interim, I talked to finance yesterday about it, saying, it seems like this is a good city umbrella thing to do, but each department will use it differently. And so it will be within us to put that cost in our budget moving forward.
What was the question?
Why doesn't the city cover it? But, I guess in a sense, Barbara, they do. I just put it in my budget.
And what are legacy funds?
Legacy funds are really just donations. And so I don't remember, Ruth, what was it? Has it been like 5 years ago, 2018, 19, 2020, maybe 4 years ago? Ruth, as well as Bob from the Friends group, we got together and we decided that we needed to formalize the way that we accept donations, because when we were accepting, the city allows us to accept donations that are strictly dedicated to the senior center. And that means they are put in a fund that can roll over year to year to year, and they can't go in the general fund. The city can't utilize those funds, but it was really informal. And so we created a legacy fund brochure
And it gives people the opportunity to feel confident that they can decide where they want the money. I was going to get a brochure. Okay. Okay, so there's the brochure. And then inside, we have categories where people can select what they want. And so it would be the ones they're kind of general: enrichment programs, volunteer program, building equipment, and greatest need. And so, every time, I was just talking to finance again about this, because every time we get a donation, we have people fill this out. And so there's never a question about, well, I gave them that money and I wanted it for this. And, so anyway, it just really formalized our donation policy.
Okay.
Jill, you worked with Barb on that.
Oh, Barb, I'm sorry. Ruth, but you too, or no?
No,
No.
Don.
I would hit on that.
Oh, God, I'm going back to some other policy, and it sticks in my head where Ruth yelled at me about not everything can be gray. Like it had to be black and white. Thank you, Don and Barb. I'm so sorry. But I'm so proud of the work we did on this brochure. Now it's coming back to me. I think it was like 2018, you guys.
Yeah.
Does that sound right?
I have a question, if I may ask. The Fitchburg Public Library has the same kind of setup for a donation to the library.
Yeah.
And we get a reminder, along about December 15th or something, that we can do this. I don't think I got a notice about anything from the senior center.
I usually in December just put it in the newsletter that says, remember, as you're planning your year-end giving, remember the senior center. Do you get an electronic reminder?
No.
Oh, okay.
I don't think so. But
Is
of
it
course, my name is Alice, and some days that's all I know.
Yeah, I never do any, we don't do any direct mailings or anything like that. Yeah.
At this point, I would just like to put a plug in for the Legacy Fund, that the Legacy Fund is a qualified charitable deduction. And for those people who are looking at their IRAs, you have to take, you get a certain age, you have to take required minimum distributions, and you can take that money out of your IRA and donate it to the Legacy Fund, and it's tax-free. So I'm taking it out of the IRA. So I think that is really something that people of 72 and over, I think it is, ought to be looking at. It's a great way to take your RMDs out.
Yeah,
And that's a good reminder, Jill, in December
yeah.
to send something like that.
Right.
Just to clarify though, you have to donate that directly to the 501c3. You can't take it out to yourself and then donate it and get it tax-free. It has to be directly donated to the Legacy Fund. So
Correct.
Oh, good.
people need to be aware of that little glitch. But back to the funding, I mean, sign language.
Barbara, can you turn your volume up? I can't hear you.
Yeah.
Okay. Is that better?
Yeah.
Yes.
Yeah. Back to the funding, since sign language is a required service, I'm still puzzled why this would be something that the Friends or the Legacy Fund would provide. Is this going to go into the budget for next year?
Yeah. I'm sorry, I didn't explain it. It's because, I'm sometimes ideas come to me and the budget's already over. So yeah, Barbara, and then we'll have a good indication of how much to put in the budget. But yeah, I see what you're saying. For sure, it should, to me, it's a city budgeted item. And I'm just going to use the funds this year out of Legacy so we can get it off the ground. But then I will include it in the budget. So thank you for clarifying that.
I mean, it's a requirement. It's not something that's done by choice or is just an extra service or an add-on. It's something that has to be.
Right.
So I think everybody, that should allay any misgivings that people have about the service.
Yeah. Thank you. And I was gonna go back to like the legacy fund. I don't think we utilized the legacy fund much. Last year, we did get some donations for COVID related things and I kept them very separate. So then we could pull those, that money out to, we bought a lot of stuff for home delivered meal people to put in the bags, you know, crossword puzzles and fun things and that kind of stuff. But the year before we used legacy funds, right before COVID hit, we got that wonderful furniture for outside that we couldn't sit on because of COVID. But we have some nice furniture that we can put out on a patio. And early on too, before we shut our doors, I think we used legacy fund money to get the Fitchburg singers a portable speaker sound system. So, so certain items like that, there's always a discussion about, well, like Barbara brought out, what does the city pay for? And then what do we take out of legacy funds? And so, you know, it's kind of like splitting hairs sometimes. Is that appropriate that the city pays for it? But, you know, I consider patio furniture kind of a fun thing. We don't have to have people sitting outside, but it sure, I think makes our facility more welcoming and just more enjoyable. So that seemed like an appropriate thing. But like Barbara said, to take out a service like translation service out of legacy fund, that definitely is a city, I think, budget item. So.
Okay, so is this an action item then, Jill?
Yeah, we do need to take a vote.
Okay, any other discussion before we vote?
I just wanted to ask, I think you said that we have some city departments that are already using it. Jill?
Well, the police department has had a translation service for a while. And then the one that Eric looked at there, I think that they got a reduced rate because it's sort of a collaboration with a lot of Dane County police departments. And so they moved over to a different service. So they've always had one. And I think that the courts have a service. They use this service. But I don't know if they've used it recently. And then when fire department heard me talking at one of our meetings, he probably will look into setting up his own account too. I don't know about other departments yet, Dorothy, beside those.
I would think ultimately to have one city account and let finance figure out how to divvy up the cost of it would be the long-term way to go, so that every department would have access to using it.
Well, the nice thing is that they waive all the fees, like they waive the setup fee, they waive because we are a government entity. So the only fees that we're going to see are the fees when we use it as a department. So it'll be very simple for other departments now to just, you know, work with the provider, set up an account. And again, I can't anticipate probably police more than anybody really racking up some major fees. But, you know, who knows?
Mm-hmm. I would think like building inspection and departments that are very actively face-to-face with residents.
Yeah.
Rec department.
Mm-hmm.
I would see a lot of areas where it would ultimately end up being used.
Yeah.
Anyone else?
Are there any other municipalities using it any place in the country that you're aware of? Do we have any?
You mean this particular service or just in general?
No, this
Not that I know of.
Okay, but I see in the contract, there is a 30-day, you can get out of the contract in 30 days, either party, no, okay.
Yep.
Okay.
Mm-hmm.
Okay, well, do I hear a motion to approve resolution R 4621?
So moved.
Seconded.
Okay, it's been moved and seconded. All in favor?
Aye.
Aye.
Opposed? Abstentions? Okay, passed. Thanks, Jill. That was a good report. We've been talking for a while about how do we reach out to people who are language challenged, so
Yeah.
that's great. Okay, report from the Senior Center Friends. That would be Judith. Hello, you got video on now.
Yeah, I'm not feeling well, so I just was listening, and I can make a quick report.
Okay.
We spent $336 on holiday meals, and $416 on special meals or needs rather, and $150 on a presentation that was educational. So we spent a little over $900 this month. We do have a travel show coming up next Tuesday, February 16th at 1 o'clock. So anyone interested in that, we'll have to get in touch with probably through the senior center to get the numbers to sign up for it.
Mm-hmm.
A virtual show.
Mm-hmm.
And we've decided to go ahead with a pancake breakfast. It'll probably be the end of April, and it will be with Hy-Vee. And the part of the reason for going with Hy-Vee is that Hy-Vee in the past has given us quite a bit of support for the pancake breakfast in terms of actually donating sausages and giving us reduced prices on the food and etc. And also they are one of the restaurants that participate in the senior center or senior month of September, when people seniors can get a reduction. So we're probably not going to make much money off from it, but we thought it would be important to go ahead and do something that we usually do.
Would that be a drive-through or people actually come?
I think they can curbside or eat inside.
Oh, okay.
Is it just pancakes, Judith, or could somebody just go in and order a breakfast and then the friends get the proceeds?
It's everything off the menu.
Okay.
And we just get a set, percentage.
Mm-hmm.
If they mention that they're from the, they're to support the senior center.
Yeah, great.
Is there a date on that?
I think I have a date, but as of the meeting last week, we did not have a date. So I hate to tell you the date. I think I know it is.
Sometime the end of April though, right?
Yes.
Okay.
Yeah, it'll be probably in the March
Mm-hmm.
Prime News in April, Prime News. So
yeah.
Okay. Thank you, Judith.
Right.
Feel better.
Yeah.
Other item, any questions for Judith? Okay. Time for Don for the Area Agency on Aging.
Okay. We met and we started watching a video series called The Uncomfortable Truth. And I think, Joe, you've probably watched this as part of the Legislative and Advocacy Committee.
Yeah.
It's a 6-part series of it's videos and discussion. We're doing 2 parts each meeting for the next 2 more months. And it focuses on discrimination, the systemic discrimination, and various groups. This time we focused on Blacks. Next time it's Hmong, and I don't recall what the second group is. And then there's an LGBTQ. What is it?
LGBTQ.
Yes. Is in the 5th series, I think it is 5th video, and it's just a real conscious raising. That's how we spent most of our meeting, is viewing or talking about that. We viewed it on our own time and came back and talked about it.
Yeah.
But no actual items otherwise.
Okay. Any questions for Don?
Don, do you have a link that can be shared or not?
No, we were told specifically we cannot share the link.
Okay.
If it's something of interest, I can check with Cheryl Batterman at the AAA and see what possibilities there are.
I think that it's also, Don, a documentary. It's called The Uncomfortable Truth. And I think I'm pretty sure, because Mandy and I looked it up. So double check. I could be wrong, but I think the discussion is kind of based on this documentary. It's facilitated by a social worker out of UW Milwaukee, right, Don?
I think so.
Yeah.
I did just this morning, in fact, looked at Cheryl's original email about the series, and she tells us specifically we cannot share it.
Yeah. But yeah, maybe Google it, Ruth. I feel like there is information out there about it.
Okay.
I thought it was really fascinating. I've been enjoying it.
The uncomfortable truth?
Mm-hmm.
The uncomfortable truth.
Mm-hmm.
Don, is the intent to try to develop in the aging community more tolerance to various groups?
Well, our intent is to raise consciousness.
Mm-hmm.
Okay.
But on that line, Jim, our legislative committee has an ad hoc committee to increase the diversity on the county boards, like the AAA board. There's the access committee, there's the legislative committee. So they are forming a committee that can just do better outreach and try to increase diversity on those county boards, on the AAA county boards.
And in effect, reduce systemic discrimination.
Mm-hmm.
Okay.
And the city of Fitchburg is also doing something similar to that.
Right.
I know Mandy is very closely part of it. Do you know enough about it to say much about it, Jill?
I do, because I'm taking the class. My gosh, it's gonna, without me looking back at my notes, I'm forgetting the organization, Nehemiah, right? So it's through there. So Mandy has taken some social justice classes through here, and so she is also like a certified or a trained facilitator. So when the city formed the diversity committee that is comprised of maybe 8 or 9 different city employees, they decided that they wanted to offer a training opportunity to department heads, as well as some other employees. We could only take so many. And so anyway, what Mandy does is she takes the course, it's all virtual. We watch the videos similar to what we're doing at AAA, and then we have a discussion after. So Tuesday was our first one, and it was a great group. There's representation, strong representation from the police department, HR, the library, myself, the clerks, and so just a nice variety of people. And then we talk about the video, again, like we're doing at the county level. And again, it's just raising social awareness. It's the history, what we learned in school versus what we didn't learn in school, and just things like that. It's very eye-opening, and I really enjoyed it. It's virtual, and so it looks a lot like this, and we have a discussion. It's 2 hours, and it's for 9 weeks. So Mandy actually was going to come this month, but I swapped them. So I'm going to have her come to the Commission on Aging, talk about volunteer engagement during COVID, and then talk a little bit about this city group and what the intent is, and sort of the makeup of the city in terms of the diversity that we see at the employee level. So I'll have her come next month.
Cool.
Good. That's all I've got, Jim.
Okay. Well, Jill, you're next for the director's report.
All right. Well, just kind of a overview of programs. We're still getting a lot of inquiries about tax help. Our poor AARP coordinator, Teresa, is just working so hard to try to get appointments here. Other sites in Dane County had scheduled appointments, and then they had to call and cancel because AARP, the state or the national level, they pulled back. They're just worried about keeping people safe and how they can roll this program out safely. So there was a few sites that got the approval to go ahead, which were northern Wisconsin. But right now there are no sites in Dane County. And people might get mixed up. There's tax service called VITA, which I'm not going to try to say what that acronym is. Oh, is that you, Linda? You know VITA?
No.
Oh, I thought you raised your hand. Sorry. But that service is going on right now on Park Street. That's always been a service. Gosh, it must be volunteer income tax assistance. That's it. Or if it's not, that is a perfect name that I just made up for VITA.
Well done.
Thank you. I think that's it though. Anyway, but the AARP tax assistance is what you see at a lot of senior centers. And so none of us are doing that right now. So if you saw it advertised, they got canceled. I know Wanakee, DeForest, Sun Prairie, they all had to pull back. So Dave gets emails quite a bit, but the last one said, we hope that we can schedule dates at the end of February. So we are just taking names and numbers of people that are calling. Some people are trying to find alternate ways to get their taxes done. So that's a big question mark and a big need. You know, we usually serve close to 100 people for tax help over the course of February, March, and April. So, so we will see. Otherwise, you know, as Amy and Sarah mentioned, we're working pretty close with a lot of student nurses, trying to do the outreach for the vaccines. It's interesting. Some people say, I'm fine. I don't need that. You know, it's just interesting to see. But we are happy to be learning that a lot of older adults are getting their shots. Dane County did supply or find money to provide transportation. That was going to be a huge hurdle once these vaccinations got rolled out for over 65. Like, who can get there if they don't drive? And so, because we don't have RSVP to take people to medical rides. So luckily, Dane County, just like about a week and a half ago, found some funding where we can call a phone number it's being managed by New Bridge, the focal point in Madison for the transportation, but people can call and get a ride to get a vaccine. So that's awesome. The nurses are also, actually there's two, they're going to start delivering meals on Thursday, two of the student nurses, just a good way to expose them to older adults and that home delivered meal program. So I'm excited about them. They should be getting here pretty soon. They're connected with a few clients that they'll be having lunch with, maybe one-on-one here in the next few weeks. And then they're doing those health screenings, it's called Million Heart screenings that actually occur next Thursday. It's at the senior center from 9 to 12. And you can come in, the nurses have been vaccinated. They'll have all the COVID safety gear on. It's one-on-one. And then they do a lot of screenings related to your heart, blood pressure, glucose. I think they take your weight. And then they do some counseling. So this is a national program called Million Hearts screenings. And so they have to be certified to do this program. So there's a lot of educational component to the program too. So they'll do some counseling after. And then at the Highline on the same day, if you can't make it here at the senior center, 9 to 12, Highline is offering it to their residents from 1 to 3. So we were able to collaborate with them to hopefully extend those screenings to their residents. So if you're interested, there's still space available. And then we have the medical students also what we're working with. And they're doing the presentations that you might see in the newsletter called Be Healthy, Be Happy. They have one Friday on depression. They're going to talk about signs of depression, especially during COVID. And then they're going to offer confidential depression screenings after. If you want to, meet with them one-on-one, they just go through a series of questions and, and if it looks like somebody's really struggling, they're going to recommend, you pursue this with your physician. So, and then they're working on 3 more presentations in March. Let's see, otherwise, a lot of Zoom programs, like Judith mentioned, the travel show. We've got a program coming up next week too. I think a pickleball Zoom. The city is looking at building some pickleball courts, and Dave has an email list of, I think it's probably well over 150 people that love to play pickleball. Certainly not all from Fitchburg, but we did become quite a pickleball hub because you could play indoors up in the Oak Hall room. So we early on with COVID, we had a lot of pressure to open up the pickleball courts. And so anyway, I think Jim took an AARP driver safety class online that we had advertised. How did that go?
It went real well. there is a cost. I think it was $20, but then when you're done with it, you send it into your car insurance company. And my company, they do give you a discount, a safe driver discount then, and it lasts for 3 years. So you get a discount for 3 years, so you easily make up for the $20.
Yeah.
It takes, I think it's about 4 hours of screen time. So you can divide that up however you want, but it's really a good course, and it's been updated since 3 years ago when I took it 3 years ago. They have a lot of modern technology and how to use it, stuff like when if you fall asleep, your car drives itself back into the lane and stuff like that. They talk a lot about the new technologies and how they work and how you don't need to be afraid of them. So,
Good.
It's a good course, real good course.
Good.
I recommended it to the men's group Tuesday.
Awesome. That's another group that continues to meet, thanks to Jim via Zoom, facilitating those monthly meetings. So there's several of those that are just going on without a hitch, and it's great. We appreciate all the volunteer facilitators that are keeping things going. We do have, if you know anybody who's getting ready to retire, tonight there's a class, it's in the newsletter, put on by Madison College as well as the Greater Wisconsin Area Agency and some attorneys from GWAR. But anyway, it is one of the most fantastic programs if you're getting ready to retire, because it covers so many things from Medicare to Social Security to estate planning, and it's completely non-biased. And so if you know anybody, direct them. I think they can still sign up because it's all virtual, which is great. Let's see, just a couple more things. Amy mentioned the vaccines, and I know several of you were able to get those vaccines through hospice. And, as word gets out, I just want to make sure that the public was aware of, it was a very limited supply. The senior center was tasked to recruit people for the vaccinations. There was never any opportunity to put something like this in the newsletter because the hospice called us, on a Thursday, and the vaccines were on the following Wednesday. So we did make a decision to offer these vaccines to our volunteers. That first round was 2 weeks ago, I think. We really tried to identify our active volunteers, those that are volunteering in the kitchen or delivering meals, facilitating classes, board members. Unfortunately, we couldn't get everybody in. In fact, we recruited 60, and then we got the call that they only had 30 vaccinations, so we had to cancel a lot of people. Yesterday, we had another opportunity. Again, they called us on Thursday. Actually, they called us Thursday and said, we think we have some vaccinations for you next Tuesday or Wednesday. Can you recruit some people? And I was like, if you can tell me what day and how many vaccines, we can try. And so we were able to kind of pin them down. Initially they said 72. We'll have 72 vaccines for you. And I was like, that does not sound okay to me, because based on the PTSD of calling everybody back the last time. So we didn't really do a huge call out. We certainly called the people that got waitlisted the time before, which were volunteers. And then we opened it up to more volunteers, like, the knitters and the crafty crew and the singers and that kind of stuff. But as Amy mentioned, we were finding a lot of people already got their vaccinations. So we kind of slowed down the outreach for that. And hospice called back, I can't remember, Monday, and said, oh no, never mind, you can only have 20. So luckily we learned from the last time. So we just had about 20 some signed up. And so then a couple days later, they say, well, we got 12 more. So it's been challenging, but worth it. with those extra few, we were able to call a few home delivered meal clients, you know, and get them over here. Some didn't have transportation, some came with family, some had a friend, but it was important to us to get those folks that are more isolated out and vaccinated. So it's been an experience. So I just, you know, how we selected people wasn't based on who we liked more. It was hard. And, you know, I felt bad, you know, because, you know, word travels and we were getting calls and why didn't I get you know, an invite for a vaccine? And it was really hard to extend the invitation fairly, but it wasn't based on anything, but we have a very comprehensive email list for volunteers, and that was the quickest we could get the word out. And it just seemed to give us some parameters to say that's who we're advertising. So I just wanted to put that out there.
Question,
Yeah.
I was one of the people that got it at a great and I'm scheduled for Wednesday next week. So those 32 shots that they were talking about, does that include the people that are already scheduled, or is there 32 additional ones beyond the ones that were?
No, we had 32 additional ones yesterday.
Okay, so
yeah, so your shot is fine next week. You're still with that first group, so you're good.
So that was 30 people there.
Correct. Yeah, both times.
So
right.
there's actually 62 then available. The 30 for second shot for the 30 people, and then the first shot for 32 people. Right.
I'm not sure.
Yes.
That's what it sounded like.
That makes sense. Yeah.
Yes.
Okay.
You should be okay next week.
Okay.
Okay. Let's see. Dave's working on the annual report that'll be due at the end of this month. It'll be pretty, we certainly don't have a lot of activity numbers, but we'll try to make it as exciting as possible during this interesting year we had last year. We're also working with one of our younger volunteers who happens to be Sarah Folker's niece. Their family lives in Fitchburg. She's a Verona High School student and she is just incredible. And so she's been volunteering all along, getting meals out for us. And she came to us a few weeks ago and said, you know, I'm the president of my environmental club at Verona. And she said, you guys are sending out like 250 those plastic bags every week for home delivered meals because we don't give the trays to the people anymore. We have to put them in a bag and hang them on the door. And she said, I really want to do a recycling initiative for you to get people to bring those bags back or save them and send them back. And then I'll properly dispose of them. So that then so we were like, that's great. You know, do whatever you need to do. We'll start that. Well, then the city reached out because they wanted to do some Earth Day events in April. I think Earth Day is the 22nd. And so I reached out to Kylie and said, do you want to make this more of a citywide event versus just the senior center home delivered meal program? So she's going to work with us to do a citywide plastic bag recycling program. And at the same time, Hy-Vee reached out. They do a little fundraiser, and they did this last year. If you buy one of their reusable grocery bags, $1 goes to the Friends. So I think the bags are $2.50, and then they'll give $1 to the Friends group. And we did it last year. It was kind of just a very passive fundraising event. We put it in the newsletter, but we're going to try to connect with Hy-Vee and somehow incorporate that fundraiser into Kylie's bag recycling. So it's fun to see. It's young kids. I say kids, they're younger. She's younger than my kids. Just be so passionate about something. And so it's fun to have her here and doing that. So kudos to her. Town of Madison, I just to let you know, behind the scenes, I'm working with the county because as I mentioned before, our funding is dependent on formulas. When we annex the town of Madison in 2022, we will be serving more adults. We will be needing more transportation. And so I'm working with the county to provide them with some census information and some data about that annexation, because that will then play into our funding. Transportation, to me, is a big question when we add that whole area. I mean, we're already struggling, and how we get those people over to the senior center, if they want to come, is going to be a challenge. So, the county's looking at that. What does that look like? Is it just increased routes? Is it a second bus that the county provides? So I'll keep you posted on that. But sort of along those lines of transportation, I'm going to meet with the new city transportation engineer tomorrow morning to just talk about what services we currently have and what services we need. I think it's really important that the commission stays in touch with what's going on with the Transportation Commission, because it's going to impact us. And I think it's important that we continue to let the city know what our needs are, and, maybe some ideas to solve those needs. So I know that Bill Horns, who used to be a council person, who now sits on our Friends Board, is also sitting on that the city's Transportation Commission, just as a resident. So he kind of keeps me in the loop too. But if any of you have an interest in transportation, and want to talk to me, I think it would be nice to have a second set of eyes watch these transportation meetings. I mean, I can watch it after, but the more engaged you guys are, the more strength I think we have. I can alert you when those meetings are. All you got to do is, turn on your computer and watch. And then when the time comes, if we should have a seat at the table, that we invite ourselves there and talk about our needs. So just kind of keeping that on your radar.
For town of Madison, we also need to stay aware that there is a building, which is a senior housing building.
Yep.
In addition to a lot of single family and apartment dwellers.
Yeah. And also too, speaking of, there's another apartment building going up near Terra Vesa. And I don't know the groundbreaking date or anything, but they're proposing 125 independent units and 46, I think, assisted living. It's called River Song. And so that's another thing to watch out for, because that will impact us. It doesn't matter what the cost of rentals are. We still serve older adults of all income levels. And I think it's important to keep our eye on that, because I think they said on the Terra Vesa is, and correct me, Dorothy, isn't it kind of is it on the other side of 14 or uptown? I get a little mixed up where Terra Vesa is.
It's the other side of 14.
Right. So by Oregon, the middle school.
If you take Lacey Road all the way east, you end up in Terra Vesa.
Okay, so that's where that development is going to be. So, you're talking here now, again, the borders of Fitchburg, and how do we move these people around the city? So on top of, as Dorothy mentioned, that apartment building off of Rimrock, that's senior housing, we add another 125 units of independent housing. We have the High Line, we have the luxury apartments over by Target. I think they broke ground. So, as the city continues to plan all these developments, I think, again, transportation services, we need to keep that in the forefront too. Like, how do we make sure that we can serve all of these residents that will be living here? So I'll keep you in the loop about that. And that kind of, go ahead.
Is the building that is where the old juice plant used to be, is that, does that have senior housing in it?
I don't think so. Dorothy, does it?
No, I think it's all market rate.
Yeah. Yeah. And then the hub as well. I know we've had a lot of talk about that. And, I've talked to the finance director about that, just because I'm curious. The stages, that northern part is really more outdoor facilities. It's kind of those covered shelters, maybe basketball courts. And, as Wade showed on his presentation, it's the other side of the street that I'm really interested, again, what is more indoor space, programming space, maybe office space. I had a meeting with someone from the police department yesterday, because, as Sarah had mentioned, we're working with them on this CIT program, which is crisis intervention training. Anyway, that's what the officers, they're being trained on, kind of mental health. But we just had a really nice discussion about just more collaborative efforts in terms of how we serve people, kind of more community policing, and how we can involve the police and they can involve us. And it's not just our department, but we talked a lot about the hub and how, you know, I don't know if he's a lieutenant or a sergeant, sorry if he's watching, but he's not. Anyway, we have very similar visions about how we can work together. And, you know, we look at that area up there and, you know, like I said, like, oh, I want to have office space so we can have social workers up there. And he said, oh, that's what I want. I want community neighborhood police officers up there. So, you know, we want to keep ourselves involved in that. I don't feel like we're being boxed out, but you know, people get busy and they work in their silos. And so it was just a really nice discussion, because I think that, you know, the police department and the senior center and, you know, EMS and fire, you know, we're kind of all human service people, and we want to help people. And I think that, as we talked about before, we don't need, some of the needs of seniors are the same of teens and youth. And so that we can really combine our efforts and utilize space, you know, in a way that just meets a lot of needs and is more cost effective. So we'll keep that ball rolling too. Let's see. I think it's a lot. I think I've kind of covered everything though.
The one you haven't mentioned is census.
Is what?
Census information.
I have none.
Okay.
Do you?
I have a little bit.
Okay.
We got notice from Dane County that the census numbers will not be released until the end of July. And nobody can start redistricting until after the census numbers come through. So the whole redistricting committee and everything is pushed into the future. So that it's going to be kind of crazy what the county has said, because there is a county supervisor elections next April, and you need to start that process early in December. If the end of July, the numbers are released, then I think that the county has 60 days to do their process, and then municipalities have 60 days to do their process. So that's July, August, September, October, and November. If by the beginning of December everything is not settled, we're going to just keep the same districts for the county that we have now. And I would anticipate that that would follow through for the city redistricting as well, is that we would change districts going forward, but the election for next year would be for the districts as they are now, which is all part of COVID craziness.
That'll affect our budget too, like the county budget. It'll delay what we know we're going to get in terms of our county contract, because that's this data has to be plugged into that formula. So,
so there will be impacts related to the release of the census data.
Yeah. Okay. Thank you.
Okay. Any further questions for Jill?
I have one. Did I hear that Diane is retiring?
Yeah, she is retiring. She's in Florida right now. Yeah, I knew it was coming, and it just, good for her. What a good way to transition, because she had that separation because of COVID and no classes, and she will still be a substitute. We actually have already brought somebody on board. We just, because they're LTEs, just our aerobics instructors are LTEs for the city. So I just had her officially signed up through HR. I think she's going to be a great instructor. She has a lot of experience with older adults, taught at a lot of health clubs, and we will be doing a free demo class, so she can sort of put herself out there and people can get to know her. And then we'll offer a 4-week aerobics class. Like we were doing that with Felicia. And she is, her daughter just had a baby. Those of you in Hawaii. So she's in Hawaii. Her daughter had a baby girl yesterday morning. So anyway, Melissa is the new instructor. So you will be able to have the opportunity to take a free class from Melissa, see what she's about and get to know her, and then we'll go forward. So there is no replacing Diane.
No.
I'm not even going to try. I'm just plugging another instructor in.
Oh, I had another question and it flew right out of my brain. As soon as COVID is over, you are going to go back live. Is that correct?
Yes, whenever that is.
Ever?
Yeah, this again, we're hoping to do some small, maybe passive programs in April. If it all works out okay, it'll be hard to bring back exercise right away. It won't be one of the first programs we bring back, but I'm hoping some smaller groups. Obviously the orders changed this week again, and that's a good sign. The city is very cautious about us reopening our doors, so kind of following their guidelines too. So, but yeah, one day, Alice.
Oh, I hope so. Yes, okay.
For that exercise class,
Yeah.
are you gonna put a notice in the flash notice or something that when that introduction is gonna be?
Absolutely. It'll go in March newsletter, and then we'll do it on that those email blasts that Dave sends out.
Okay, so
Yeah.
it'll be March or April then?
She'll start in March. Yep.
Start in March.
Yeah,
Okay.
the demo, I think maybe the second week in March, and then the 4-week class will follow.
Okay.
Okay.
Thank you.
You're welcome.
Anything else for Jill?
Thank you.
Okay, any announcements? I'm just wondering, on the first agenda that we got, we said there's a commission meeting on March 11th, and now this one doesn't have it written down. Are we meeting March?
Yeah, maybe it got chopped off or something, but yeah, March 11th.
Okay. If there's nothing else, do I hear a motion for adjournment?
So moved.
Second.
I second.
All in favor?
Aye.
Opposed? Okay, we are adjourned. Thank you very much, everybody.